Okay, hello, good morning, everyone, and welcome to Stanford Healthcare Nurse Residency Program Application Preparation Webinar. Please note that this webinar will be recorded. We will have a Q&A session following the program presentation, so we ask that you hold all of your questions and chat discussions until that portion of the session. So let's get started. One second. Sorry about that. So I'd like to take the opportunity first to introduce the rest of the nurse residency program team. I think I skipped a slide, but it's okay. Along with Carrie Zoss and Christy Norris, we make up the nurse residency program coordinating team, and Carly Day is our HR partner and senior talent strategist supporting the nurse residency program. We're excited to have 3 of our current nurse residents joining the session today. They're going to be able to share what made them successful in the application process, and they'll be joining after the general information session. All right, so before we jump into the information on the nurse residency program, I'd like to highlight who Stanford Healthcare is for those of you who may not be familiar with our organization. So Stanford Healthcare is a large academic medical center with more than 300 facilities throughout the Bay Area. We are the only level 1 trauma center between San Francisco and San Jose. In total, Stanford Healthcare employs over 15,000 people, and of that, 3,500 are clinical nurses. Our Palo Alto campus, which is sometimes referred to as 500P or the main campus, has 605 licensed beds, 100 of them being ICU beds, and we do have 53 operating rooms. To get a sense of the footprint, the main campus, or 500P alone, is over 800,000 square feet. There are approximately 450 life flight transports annually, along with 72,000 plus ED visits and over 2 million outpatient visits per year. So we are a large, high acuity specialty academic medical center. So now on to who we are as a nurse residency program. So we are recognized as a nurse residency program since 2006, a Vizient nurse residency program, that is. The Stanford Healthcare Nurse Residency Program is a nationally accredited transition to practice program through the American Nurses Credentialing Center, the ANCC. So the ANCC sets the standard for residency programs that transition registered nurses into new practice settings. We align with the Institute of Medicine's 2010 Future Nursing Report recommendation that the implementation and evaluation of nurse residency programs is needed. We have supported the successful transition to practice of over 200 newly graduated nurses each year into the following clinical settings. So we've had nurse residents in critical care, emergency department, inpatient medicine, inpatient surgical, oncology, dialysis, the perioperative setting, the inpatient and outpatient, clinical trials, and psychiatry. The overarching goal of the comprehensive 1-year program is to develop competent, compassionate, and committed clinical nurses who make a positive impact in the lives of our patients. Before moving forward, I'd like to invite everyone and join us in celebrating our very own Carrie Zoss. Last week, she was awarded Coordinator of the Year at the Vizient AACN Nurse Residency Program Conference. So we're very happy and proud of her. So I want everybody to give a round of applause. Join us in congratulating Carrie. Okay, so back to our regular programming. Part of how we meet our goal, being able to develop competent and compassionate, committed clinical nurses, is with our curriculum. We use Vizient's nurse residency program curriculum, and it was developed in partnership with academic medical centers and the American Association of Colleges of Nursing. So it was developed during a time when many nurses were leaving the bedside or leaving their new role as new nurses within the first year of their career. So the goal or objective of this curriculum is to support the new graduate nurse in their transition of practice, something that was needed then and still needed today. So our program integrates the 3 principal domains to include leadership, patient outcomes, and professional role. So at a glance, you may notice in our curriculum, we don't go over systems or disease processes as a nursing school. This is intentional because we don't reteach nursing school concepts or topics here in the nurse residency program. What our program does is take all of your background knowledge, your skills, your experience, and we build upon them. So we connect it all and kind of gear it towards how it can be applied into the clinical setting. So we can go over the domains, and we'll begin with leadership. When we go over leadership, we discuss topics like conflict resolution or patient care coordination, and we use effective decision-making skills and prioritization. With professional communication, that not only includes what elements are critical for clear and effective communication in the clinical setting, but it also discusses how to overcome challenges in communication. So when your messages aren't being received the way you'd like to, or maybe you're not sure if you're using the right methods for different ideas, we go over that as well. We also go over resource management, knowing where your resources are and how to find them when you're unsure of something. When we discuss patient outcomes, we look at managing a patient whose condition is changing. So how do you respond and not react to situations? How do you integrate the patient and family in teaching, the patient and family in the need when there's teaching to be done? And as mentioned earlier, we build upon knowledge the residents come on with. So our nurse residents have a wealth of knowledge on what contributes to patient outcomes. What is new for them is applying these interventions to multiple patients with multiple acute and pressing issues. So whether it be pain management or infection prevention, we discuss how to juggle all the new responsibilities with patient outcomes in mind. For professional role, we emphasize well-being. We're really proud of the content that we've been able to integrate in the program. It hasn't, because not too long ago, once upon a time, when Christy, Carrie, and myself were in nursing school, this wasn't something that wasn't really addressed in curriculum as our new jobs. So we've listened to our residents, we've looked at research, and we found ways to help residents identify tactics and strategies to care for themselves, not only during this first crucial year, but also long into their careers. We've incorporated evidence-based research into the program. So nurse residents will spend 5 working sessions in a group on an EBP project with a coach. The project will be presented at the end of the program, and we'll go over a little bit more what that looks like later. But the idea is we want to expose nurse residents to professional growth options and planning. So we assist with formulating individual development plans and really just asking our nurse residents to look forward to the next 2 to 5 years and where do they see themselves. So we provide exposure and information so the resident can put themselves on the right path to achieve those goals. Okay. Looking at our program structure, it consists of 4 categories. So including clinical orientation, collaborative check-ins, program seminars, and an EBP project. This is what essentially drives our program. So we can take a little bit of a closer look at each of them. So with clinical orientation, our nurse residents get over 350 hours of clinical orientation with a trained preceptor. We use the tiered precepting model called TSAM. Each tier builds on the previous. So essentially it's a progressive and incremental skill acquisition model. The resident moves from simple to complex care concepts. So for example, the nurse resident will start with caring for all the patients in a given assignment, but their focus will be on simple concepts like vital signs or assessments. Once that tier is mastered, they advance to assume more responsibility building on previous tiers. And so that's just the idea of how we structure orientation. The specialty you are hired into will determine the length of your orientation. So depending on what has been shown or proven to be the right amount of time for orientation in a given area is what that you will follow. So again, our goal is to safely transition our nurse residents into independent practice. So really every area is tailored to what the needs of that area. So the second category is check-in meetings. So we follow the nurse residents with supportive and collaborative check-in meetings over the course of the 12-month residency program. So as a member of your nurse residency program team, so Carrie, Christy, myself, or one of our partners here in our department, our nursing professional development specialists, will collaborate with your unit leadership and follow your progress during the program to offer support when needed. So oftentimes we're celebrating successes, and we'll help identify opportunities for refinement or opportunities for improvement. If necessary, we'll come up with an action plan and support the resident to have a safe and successful transition. So we're never just, focusing on the good or not addressing anything that could be improved, and we're always working towards getting you that safe and successful transition. The third category includes seminars. So our seminars are facilitated by the nurse residency program faculty, again, not to reteach nursing school concepts, but instead we integrate concepts that support your development and teach you how to apply knowledge, skills at the bedside. So the topics that we go over in seminars, some of them include clinical reasoning, we go over prioritization, communication, resource management, how to escalate, managing feedback, error, having crucial conversations, and teamwork and team building. We also engage in reflective journaling and large cohort debrief sessions. As I touched on a little earlier, we go over and we have an evidence-based practice project for our nurse residents. So all nurse residents are required to complete an evidence-based project. The EBP sessions are integrated into seminars, and they support the development of critical thinking and clinical reasoning. Projects are aligned with the specialty areas that the residents are in, and they're supported by the NRP faculty and CNS coaches. The projects are going to be presented at the end of the residency program to the cohort as well as unit level. So depending on the type of project completed, it may be there may be an opportunity to present at the house or organization-wide level or additional meetings and committees that maybe your topic is suited to. Okay, so as much as we want to recruit amazing clinical residents, we want to keep you and grow you within our organization. So Stanford Healthcare is uniquely able to provide nurses with many opportunities for professional development. We're committed to growing and developing our clinical nurses from the moment that they enter the nurse residency program and throughout their career. So once a clinical nurse promotes to clinical, or a nurse resident promotes to clinical nurse 2, so it's around 6 months or so, they have access to tuition funds that can be used towards formal education opportunities. So examples of that would be continuing education opportunities, like you found a course or a class that you thought would be a good addition to your knowledge and skills of where you work. You can use those funds for that. Say you meet the criteria to test for a specialty certification, you can take a course and then also be reimbursed for the specialty testing. Or if you want to use those funds to advance your degree, go back to school, or have any formal educational opportunities, that's also available to our nurse residents who are past the 6-month mark. So there's other ways to develop yourself professionally, not only in education, but we have things called unit champions. So at the unit level, you could participate in beat championing a certain topic, whether it be falls or CLABSI or rounding in just for patient satisfaction or wellness, are all opportunities that you can join in at the unit level. You could also participate in house-wide organization committees that really look at and focus and implement change and try to sustain it, looking at patient outcomes. There's also opportunities for mentorship. So we have integrated mentorship into our nurse residency program. So there's an opportunity while you're in the nurse residency program, you are a mentee, but also after. Most of our mentors that are participating in this program are former new grads, former nurse residents from the program. So we're really happy, and it's like a full circle moment for them. So that's another opportunity to develop yourself professionally. Our HR department, we have Carly, one of our partners. Her department does a really good job at having mobility events. And what those are is they have these really big events, invite everybody in, and just gives you opportunities to see where you can maybe move or transition into the organization. There's transition to practice opportunities. We'll go over those a little bit more shortly, different areas of training and movement. And then later, after you are in the expert phase of your career, you have opportunity to participate in the clinical ladder promotion. So having different things that you can participate in will put you up for a promotion in the clinical setting. Okay, so this is a list of the hiring units for our next cohort. A question we often receive is how many units will be hiring or how many will be hired, and it always depends. And that amount fluctuates based on the available positions in the organization. Currently, we don't have a set number, but we have the regions that will be participating. So we're a specialty hospital, and the specialty regions for this cohort include oncology, surgical, medical regions, in addition to the emergency department, psychiatry, float pool, and clinical trials department. AAU is listed here, and that may be a new term for you, but it's unique to Stanford, and it stands for Acuity Adaptable Unit. What sets Stanford apart from other hospitals is our ability to adapt to the patient's needs. So when outside of the critical care areas, our AAUs, I'll call them, can care for patients from acute care, 5-to-1 ratio, to intermediate care, which is 3-to-1 and sometimes 2-to-1 if needed. So let's give an example. If an acute care patient requires more frequent intervention or monitoring, they will be changed to an intermediate level of care. Our AAUs are equipped to manage their care instead of other models that I would say grew up, but I was used to seeing when I was a newer nurse, is where the patient would need to be transferred to another unit to be able to manage that care or flex to stay there and take care of that patient. So here, the nurse's assignments can be flexed and they can stay within ratio to accommodate the needs of the patient. It saves both time and energy and maintaining staff and patient satisfaction. So the nurses, okay, so in our surgical AAU specialties, we have example of units that would be participating or cardiac surgery, hepatobiliary, and trauma. Medicine AAUs have specialties such as neurology, advanced lung disease, cardiac medicine, and oncology has hematology, BMT, and general oncology units. So those are some examples of units housed within those specialties. I just wanted to give an idea of the types of specialties that are categorized there. The ED is the main emergency room, so residents there are trained to care for patients there. Float pool serves as for surgical medicine and oncology AAUs. So this is also where the training takes place. They have a certain designated time that they train in each area or region. And depending on the needs of the organization, these nurses will float where they're needed. So they don't have a home unit, as you would say. Clinical trials nurses care for patients participating in trials. So the patient may be admitted here in the hospital for something unexpected or maybe a planned surgery, but they're enrolled in a clinical trial in the outpatient setting, or they may be enrolled while they're admitted. And as you can imagine, this is a large academic facility. Patients can be undergoing trials all over the hospital with varying specialties, within varying specialties. So similar to our float pool, our clinical trials nurses are dispatched to the medical, surgical, and oncology areas to care for these patients. When there aren't any patients admitted with clinical trials, the nurses will float to the area as needed, as supplemental staffing. Our psychiatry unit is an inpatient unit here on the main campus. So with all that, you've made us, we're a very large facility and we're always changing and expanding. At Stanford Healthcare, as the Stanford Healthcare footprint expands, this cohort will have an opportunity for nurse residents to be hired at one of our offsite acute care units. So something to look at when the application opens. We will talk about ranking and specialty selection a little bit later in the webinar, but I want to point out here that there's areas that have more of an abundance of opportunity, meaning like med, surg, and oncology, rather than ED, psych, float pool, and clinical trials, being there's more units housed in those regions, medical surgery and oncology. ED, psych, float pool, and clinical trials are smaller units, so they may have a smaller pool for opportunities to interview. It's more competitive. So I share this with you so you just make some informed decisions on your preferences in your application. So if you have limited to no clinicals in the ED and knowing they're only hiring a few, maybe you think about it and decide if that's your best, opportunity for you, or if you want to select an AAU where there'll be more eyes to see you. So completely up to you, but does warrant some thought. Okay, moving on to specialty training programs. So within our nurse residency program, we have specialty training programs. So all of our nurse residents participate in the nurse residency program. This program requires your full commitment. Seminar participation is mandatory. And depending on the specialty area that you're hired into, you may be participating in an additional program to support that transition. So currently, the residents that are hired into ED and oncology will also participate in training for those specialties. So that might consist of in-person classes, maybe some virtual training, skill sessions or simulation, all things that will be extra time in addition to your time on the floor and your time to the nurse residency program. We just want to be fully transparent so you can make informed decisions when you're applying and selecting your ranking or specialty areas. We want you to just be aware of the expectations. That's if you choose a defined specialty. Of course, we're always here to support your development and your growth. But we don't want you to be surprised either by additional work or additional hours that are required with this job commitment. Okay, so let's just take a look at this timeline. So the application is going to be for cohort 41. So currently we're at March. We're in March. The application is set to open in a couple of weeks. April 1st to the 14th, it'll be open for 2 weeks. So that's that star there. In between the time it closes and the time that we have interviews, there's a few things that are happening. We take a few weeks to go over all of the applications, and our P team and our partners here at our NPDs look at every single application. So we've been looking at about 1,000 applications every cohort. So we're reading all of the documentation that you're going to be attaching to this application. We'll be going over shortly. So it takes us a good amount of weeks. And then after that, we start to build the interview panels. And then the week of June 17th will be when panel interviews will be occurring. And the week of June 28th is when unit level interviews can be occurring. So those are some highlighted weeks there that you might want to be looking at. You might need to be available for an interview. Also, HR offers will go out, and there'll be some weeks of processing. So July to August, there's things, pre-employment clearances that need to be happening. The third star on this chart here is your California license. So California license needs to be in hand and on the Board of Nursing site by July 12th of this year to be able to start the program on August 19th. So just looking at that timeline, some dates to review. You can take a picture of this. We'll also post this online, but just some ideas where you might need to be available and some deadlines. Okay, so now we're going to go over the residency program application. So let's just quickly walk through the application requirements. So first, you must be a graduate of an accredited nursing program. So whether it be ADN, MSN, or an accredited online program, you must be a graduate. You can apply if you're in progress, if you're graduating soon and you're going to have your license by the cutoff date. You can have no more than 6 months full-time experience as a registered nurse. So if you do have more than that, you're welcome to apply to clinical nurse 2 positions here at the hospital. Your official graduation date can be on your transcripts can be no greater than 18 months from the cohort start date. So we're looking back at your graduation can be no farther back than February of 2023. And then you need to submit all the required application documentation. Not too many things to look at. A lot of it, you already hit the buckets if you finished nursing school, no minimal work experience, and you're a new graduate. But you're going to be looking at this required documentation and wondering, okay, what all do you have to get ready? So that's what we're going to go over next. So this is the documentation you'll be required to submit on your application: transcripts, cover letter, resume, and completion of some questions in an electronic application. So we've already reviewed transcripts. They could be official or unofficial, just making sure that graduation date is no farther than February of 23. And then we're going to go over each of these other items more in detail. So let's start with a cover letter. So a cover letter is going to introduce an employer through introduces you to an employer through personalized explanation of your qualifications and interest in a position. So employers use a cover letter to get a sense of who you are and how to use your experiences to accomplish the requirements of a position. In a cover letter, you may wish to share a few things. You can have a theme, or you can, sprinkle a little bit of everything into a cover letter, but things that you can share may include why you pursued a career in nursing, what motivated you to join this profession, maybe what have you done to get to this point in your career. You can share what makes you uniquely qualified for this role. So you can, give a little bit of explanation of maybe some of your job experiences, personal experiences, maybe if you've had some opportunities in your clinical rotation or work experience, volunteer, any of your life experiences that makes you unique, you can share and kind of relate it to the job that you're applying to. You could also choose why you chose Stanford. What are you looking for in an organization and how your values are aligned, or maybe, you know, how you would be a good fit. You can also share what you plan to accomplish in the future, maybe giving a little bit more insight of your goals and your thought process and how you see things. The main purpose of this cover letter is to support the content of your resume. So your resume is going to, and we'll go over it next, is going to focus on your qualifications, achievements, past experiences, but your cover letter is going to expand on those achievements and showcase your personality and explains why you've been a good fit for the organization, gives insight to those soft skills, attitudes, and motivation. So think about it in this way. With everyone coming in with a similar education and training, you can take this opportunity to shine and show your individual experience or achievements or what makes you stand out compared to others. So resume is going to be more marching down the line, black and white, but a cover letter is something that you can integrate a little bit of your personal experiences, kind of give it a little bit of a voice. Okay, so again, employers are going to use those cover letters to get a sense of who you are, and how you would use your experiences to accomplish the requirements of a position. A resume is going to provide a summary of your experiences. It's going to state relevant information regarding your education, your experiences, and job-related interests. It's going to demonstrate what you've done in the past, and it should align with the qualifications that you're in the job you're seeking. And we'll go over that when we talk about work experience. But you could think of the resume as your personal marketing tool that allows you to effectively communicate your assets to a potential employer. So looking at the slide here, you can display all of the things here on a resume as you'd like. The format's up to you, but just need to make sure that all of these things are here. And there's some areas that are bolded that are going to be scored. So definitely paying attention to what is listed here to include it, so you meet the requirements of this resume. So beginning with your education, you want to include your nursing degree, your nursing education, school and date of program completion. You can also include non-nursing degrees if you wish, but if you're running out of space or you want to have a goal to have it look a certain way, the main thing is including the education that you have for nursing. But I'd also be proud of other degrees. It shows a lot that you've accomplished other things. Clinical rotation. So the nursing curriculum, you want to list the nursing curriculum associated with each rotation, clinical location of each rotation, and the number of hours of each rotation. So including that, and you can also put this in a list. You could put it in a table. However you'd like to display it is up to you. Now we're going to move into the next categories that are going to be scored. So when looking at work and military experience, we want you to list the job title or the role that you had, the employer of the branch of military, the time of employment, so the dates that you were there. If you're still there, you could put present, and your roles and responsibilities. Volunteer experience, kind of the same format. What was your title or role, where you did this work, and the number of hours of volunteered and your roles and responsibilities. Hours of volunteered is very important. You want to make sure that you get credit. So include, if you don't know, maybe try to reach out to the agency, find out a summary or tab it up. But it's really important that you put the number of hours. Nursing internship or externship. So you're going to want to include what your title or role was, where you did it, who was your supervisor, the time of your internship, and your roles and responsibilities. So these are all areas that are very important elements to your resume. And if you don't have them completed, you might miss out that it wasn't there. References. So we ask for a minimum of 2 references from School of Nursing clinical faculty. So we just want contact information. We don't need a letter. So we have realized within the last few years it's become increasingly difficult to have clinical instructors write letters of recommendation. So we recommend that you let them know or ask their permission to be put down as a reference. And when they're contacted from management, they will be prepared to speak towards your clinical performance. And that's what we ask. We don't need them to write letters. If they're called upon, they should be ready to speak to it, because you should have asked for permission to put them down. Okay, so we get a lot of questions before we move on. We get a lot of questions about cover letters and resumes and how long they should be, what the format. should be, and if we can go on it. I think the main thing is they shouldn't go on and on. You think of your resume as an advertisement. It advertises you and your unique skills, qualifications, and stresses the benefits you have to offer. So keep it concise and be sure to hit the marks outlined here. I think that's the main thing that you can focus on first, and then you can look at how you want it to read and be fancied up. Okay, so in the electronic application, there's 3 components to this. So you're gonna be asked some demographic information and application questions. So where did you hear about this position? Are you willing to commit to a 1-year program? Maybe you understand you need to have your license by the certain date of July 12th. A lot of yeses and nos. Then you're gonna be asked to rank the specialty that you'd want to work in, like in the preferred setting. So there's an opportunity to rank these areas. So we try to place people in their top 3 choices. If you have a passion for a certain area, I would say select it as your top rank. If you're unsure or open to different areas, keep in mind there are more departments interviewing in the med-surg oncology regions rather than the ED, psych, float pool, or clinical trials, whose departments are smaller. So just to keep that in mind, sometimes people aren't really aware of that. So, but if that's your passion, I would say go for it. The opportunity to interview is more competitive, meaning there will be, I'm sorry. So then we go over the application, the electronic portion of the application. So you're going to be required to answer 4 questions. Each question has multiple components, and you're going to be required to answer all of those components to the question. The length of the answers are up to you. We accept them regardless of how long or short they are. We're going to go over those questions shortly. We've mentioned items that are scored on the application. So those of you who weren't able to participate in any extracurricular activities, you don't have military experience, maybe you've not had the opportunity to do the intern or externship. The next portion of the session is going to be really important for you because the applications can have the ability to impact the scoring of your application. So don't feel discouraged if you don't have those other things to list on your resume. The next section of this webinar is going to be where you can change that. So these application questions, they all consist of 3 elements. So describing a situation, what happened, what did you do, and share the result. So this is an example of the first question. Tell us about a time during your clinical rotation when you experienced a caring moment with a patient. How did this moment affect the patient's outcome, and how has it changed your clinical practice? So you can, part 1, we can talk about you sat with a concerned family member. The family member felt relieved and calm. And, we could talk about they felt relieved and calm. So that's how did it affect their outcome. And what do you do now? What do you do differently? Another example is, you washed and styled the patient's hair in anticipation of their family visiting, verbalized they were feeling refreshed and beautiful, and where they were smiling when their family visited. And you can then share, what did this moment teach you about the human-to-human connection, right? So really just telling the scenario, what happened, how did it affect the patient, and then how has it changed your clinical practice? What do you do now differently? So you want to leave no response open to interpretation. If you answer the question, make sure that you are acknowledging every part of the prompt. So, for example, a time in my clinical rotation, I had a caring moment with a patient. I'm addressing that. I made a patient laugh during a stressful time. This moment affected the patient's outcome because they said they haven't laughed that hard in a long time, and it felt so good. This changed my clinical practice because I am now more aware of the human-to-human connection and how that can change the way a person feels. So again, outlining the prompts to make no assumption or make nothing open to interpretation. That, again, these are real people reading these responses. So you want to make it clear that you're addressing each component of the answer. The example I just gave, all components were answered easily with one-liners, but what's going to make a response successful or give you the opportunity to have more impact on your application is how you're going to respond to the 3rd section of the question. So take your time to answer these questions. It could be a difference between an average answered question and an excellent question. So we're going to touch on that on the next slide. Okay. So first, let's look at all 4 questions. You can take a picture of this. This will be available to you. But again, the bolded areas are the third component in the fourth question. It's sprinkled in there, but let's read them. Tell us about a time during your clinical rotation when you experienced a caring moment with a patient. How did this moment affect the patient's outcome, and how has it changed your clinical practice? The second question, tell us about a time you had an error in judgment. It can be personally, professionally, or academically. What happened? What did you learn from this experience? And how has this experience shaped you into the nursing professional that you are today? Tell us about a time you provided service to the community. What type of service did you provide? How has serving a community prepared you for a profession that is committed to compassionate service? The last question, successful completion of a nursing program requires hard work, persistence, dedication, and resilience. Share with us what initially motivated you to pursue a career in nursing. What goals did you set for yourself? What obstacles did you have to overcome to achieve these goals? So when preparing your application, you want to refer to these questions and think of some experiences and scenarios that you could use. So brainstorm a little bit, write some ideas down. But when you really think about it and you're thinking of what you're going to respond, think about that third component and question if that's a good scenario that you want to use. So the questions you can ask yourself is, what made this experience memorable? Like, why does it stand out to you? Kind of try to identify that while you're brainstorming. You can think about, how did you go above and beyond? If it's not explicitly apparent to you how you went above and beyond, or you can point out where you went above and beyond, note that. Think of how much reflection and learning occurred as a result of this experience. So did this really impact you and change you in different ways? Did it change you how you perform or how you interact with your family, your friends, and also in school or your professional setting? Really thinking about, how did you put this lesson in action? How did you now demonstrate what you learned from this interaction? How did it affect you? Sometimes it affects, a lot of times it'll affect the patient, but the question is, how did it change you? How did it change your practice or your interactions? You can share and emphasize how it did beyond nursing. So you don't have to keep it only how it changed you or adjusted your performance in the clinical setting. You could use examples of how it's affected you in different ways, or how it's shaped you. You can ask, did you demonstrate a growth mindset? And is that evident in your response? By growth mindset, we're talking about, you have faced some adversity or struggles with certain skills, but you didn't give up. So with time and dedication, hard work, you developed those skills and improved, or you had some lessons learned. So we just want you to look into that. And if that was apparent there, emphasize on it. So I'll give you an example of question 2 response. So a time that I made, again, leaving nothing open to interpretation, a time I made an error judgment was with my daughter's dance class. I inappropriately judged a parent for being late, only looking how it inconvenienced myself and other parents when we waited with their child until they arrived. Although they were always apologetic, I would annoyingly ask myself when they would get it together or why they couldn't get it together. That is until I was going through a stressful time and I was often late. When I would arrive, I found the other parent was the person waiting with my child. I apologized and they shared with me they understood, and also shared some of their struggles that included caring for the parent and juggling 2 jobs. I was embarrassed and humbled. I learned to lead with grace for myself and others and remembered that I will never know what people are going through. At this point is where you can demonstrate how you lead with grace and what you do to remember everyone has their own story and everyone's going through things. So this is where you can also share how it shaped your practice and how do you do different to address this. So again, answering each prompt, giving some reflection, but also where you're going to bring it in is this part 3 and demonstrate how you did these things. Because you can say, I learned to manage my time more. Okay, well, demonstrate, show, give examples of how you do that. So that's the difference of where you can have a response that answers each prompt or goes above the expectation. Okay, so we're going to move into some general frequently asked questions about the cover letter and resume. I think we addressed this, but how long and how should I format my cover letter? So you can have it be however long you'd like. Format is up to you. This one is the one where you can kind of showcase yourself. So who should you address the cover letter to? It could be Stanford Healthcare, to whom it may concern, just as long as it's general, or to Stanford. Does Stanford reach each cover letter, or do they use software? No, we don't use software. It's all of us and our team reading everything that is submitted. Should your cover letter target specific specialty area that you're interested in? It's up to you. Again, you're ranking the areas and you're placed in interview panels based on that ranking. So you can target it, but that might not necessarily be who's reading it for interviews. Should I share my work experience even if they are not healthcare related? I think if you can share your work experience, whether it be your cover letter or resume, I'm kind of going to refer to the resume, and it is pertinent to something that you can apply in nursing, I would share it. So an example is a lot of our new grads have jobs in customer service or food service, and they learned a lot of things that they can apply at the bedside. So I would say if you can use that experience, I would say it would be a good idea. Should I share my senior preceptor experience even if it wasn't in adult medicine? Yes, because you did learn things that you can still apply to adult medicine. Should I share why I think I should be an asset to your organization, or does that come off as bragging? We invite the bragging. We want to hear all the good things about you. This is your opportunity to tell us if we haven't been able to see it already in the resume. How long should a resume be and what format? Again, you can make it as long as you'd like, but I would want to make sure all the required elements are hit and they're clear to see. How should I format the clinical rotation? You can put a list or a chart, whatever fits and looks good. What do I do if I'm still completing my clinical hours? You can put in progress, that's fine. We don't give extra points for attending certain nursing schools or having a GPA or having higher degrees, or do we give extra points if you've had clinical at Stanford Healthcare? We don't give extra points, but I would still encourage you to note it on there. It's important because you've already had exposure to those areas. So if you are applying for your ranking and you're being put in a surgical interview panel and there's 2 panels, we would love to give you the preference of being put where maybe you've already had some exposure. Should I list non-healthcare related work experience? Most definitely. If you feel like you could be targeted, we give points for any work experience. So if that's the only work experience that you have, definitely do that. If you have long lists of different jobs, it's up to you what you want to fit on that resume. All volunteer work is accepted. Just be sure to highlight those volunteer hours, the times that you did it, who is your contact, and what did you actually do there. What is considered an internship or externship? The general idea is that you probably had to apply for this. It was under the role of a nurse, and there was a time frame of when you started and completed this intern or externship. It could be paid or unpaid as well. If this was something outside of nursing or not under the role of a nurse, it wouldn't be considered to qualify for this type of internship. Or externship. It needs to be nursing related, under the role of an RN, or under, working under an RN, working with an RN, and those things. Should you provide your RN license information? You can provide it on your resume. It's not needed. We have the cutoff date of July 12th, understanding there's a lot of people still graduating and they're senior capstone currently, so that's okay. You don't need to provide ACLS or BLS. That's something that in your pre-employment clearance will come up, but currently just to apply, you don't need to include it. Can I list other elements on my resume? Most definitely. If that's how you want to format it, we welcome that. For your application questions, can I apply before I graduate from my program? Yes, if you're in progress, most definitely. Can you apply before you have your license? That would be a yes as well. When do I need to have my RN license? Would be July 12th. Can I choose my specialty area of work? So you have an opportunity to rank the preferences, and we try to place people in their first 3 preferences. We do behavioral style interviewing. Moving more towards June, we'll have an interview prep webinar. We invite you to keep an eye out. We can go over that in more detail. We don't know how many people currently we're hiring. We just know the areas. It's always dependent on the needs of the units and organization as a whole. If you've applied before and you weren't selected, you can definitely apply again as long as you still meet the criteria, mostly looking at that 18-month deadline. Can you choose only one specialty? I say if that's the specialty you are that area or nothing, you have the opportunity, you have the liberty to do that. We don't offer interviews in more than one specialty. Like I said, we have around 1,000 applicants every cohort. It takes a lot to put people in these areas. And so just to be fair, everybody gets placed in one specialty area. It wouldn't be feasible to offer multiple areas. Can you have another job? I feel like this is a very question that has a lot of legs and has a lot of answers. But like we said, the nurse residency program requires full commitment. There's a lot of training and time needed. So having another job may be a distraction. I wouldn't recommend. So it's something that you need to look at. Looking at the next question, is it manageable to be enrolled in a BSN bridge program? We have had people complete the bridge program while they were in our program. We've had people start it and maybe not finish, but they've completed it. But we've also had people start and pause because it became a little bit too much while they were on orientation. What if I have a planned vacation during the first month or two of the program? I would say be flexible with those dates. There's a lot going on in the first few months of orientation, especially you're at the will of the mercy of your preceptor's schedule. There's a lot of training, things that can't be rescheduled. So, this is something that you need to look at. And if you are having the foresight where you can't cancel it, this may be an issue. Our managers are greatly accommodating, but again, I would be open to that you need to be flexible with that. And also there's times that people don't have enough vacation time to take those vacations. So that's the word there. Moving into some application reminders. So application checklist, make sure you have your transcripts ready. If you have been out of school for a little bit and you don't have access to the portal anymore, you might need to go and contact the school. You need a cover letter and resume with all the listed requirements, and you need to complete that electronic application. We do recommend getting everything aside from the electronic questions, so your transcripts, cover letter, resume, in one file. So when you submit, there's no problems. Don't submit the following. So we don't need an RN license uploaded. We don't need BLS or ACLS uploaded. You don't need to upload any additional certification or letters of recommendation. Apply only one time. So if you're concerned that there's an error in your application, please email newgradrn@stanfordhealthcare.org and state what the error is. Wait, and they will respond with next steps. So just be mindful. This ties into that you don't wait until the last minute to apply. Late applications aren't accepted. So if you're applying a day before it closes and then you're having an issue and you email this email, there may not be somebody on the other end answering at that time. It's closing over a weekend. So get on there early, start being familiar with what's needed, and that way you can have time. I'm going to skip down because applications that don't have all the required information are rejected. So if you apply early and for some reason one of your documents is not uploaded and it's rejected, you will have the luxury of time to reapply. If you wait till the last minute, you don't. Please use one identifier. I'll give myself an example. My name is Leticia Cortez. I sometimes answer the phone calling myself Letty, my nickname. I sometimes answer in Spanish. But with that, I would use to apply to this program Leticia, because that is all on my legal documents and everything's going to match. So keep that in mind, that there's no question. You don't want to leave anything open to interpretation. Okay, so again, answer all 4 application questions, all elements, touch on them, and don't leave anything blank. All right, so I'm going to invite Carly to come on and go over the salary and relocation information.
Thanks, Letty. And I know a couple of these questions were getting asked in the chat, so hopefully this will clear everything up. So starting here, every new grad starts at the same pay rate. You'll be starting at $85.77 an hour. Plus, there will be shift differentials based on whatever shift you get accepted into. One shift that you'll see a lot with all of our nursing roles is rotating. Your schedule could be 1 month days, then 1 month nights. It could be 3 months days, then 3 months nights. Be prepared to be on rotating starting. 90% of our new grad positions start on rotating shift. So you get a couple perks here with the 18% shift differential on top of that base rate. You get parking perks for working night shift. So there's a lot of fun reasons to work night shift. It's also, from what I've heard, a lot busier. So you'll be experiencing a lot more. For those of you that live out of state, we love out of state applicants. We've hired our last couple of cohorts, at least 50% have been relocation candidates. So don't feel like you're, don't have a step up because you're not local to the area. If you are more than 120 miles outside of Palo Alto, you will get a $5,000 relocation sign-on that will be on your second or third paycheck. It's paid out in lump sum. We also have different relocation services. We have a couple of short-term rental programs here for looking for temporary housing. Unfortunately, we don't have the ability to help you meet other people in the cohort to get ideas on roommates. A lot of our patient care managers are great, though, about making recommendations on where other members of their unit live. So you kind of get an idea. We also have information on transportation. We have many transportation options here. We have a free shuttle, free park and ride. We offer discounts on BART tickets. So a lot of things to help make your commute easier. Benefits start for you the first day of the month after you start. So with everyone starting in August, your benefits will kick in on September 1st. PTO starts accruing that day. You receive 36 days each year, and that includes holidays. And it accrues. So for the first couple months, please don't plan vacations because you will not have the PTO, and we don't allow you to go negative within those first 6 months. Then you can go to the next one. So for the benefits that kick in immediately for you, medical, dental, vision, everything kicks in. Medical, we have three plan options, and the first one is actually employer paid. So even if you're on your parents' plan, get on this one. It's always great to have one, and it's free, so why not hop on it? You will also be eligible for tuition reimbursement, and that is a little low. We now offer up to $2,000 a year, and it can also be used to put towards your student loans. So you have the option for tuition reimbursement or to pay back student loans. And as far as tuition reimbursement, you can also utilize that not just for taking courses or certifications. You can also use it to attend different conferences. So if you get hired in our units and you want to go to ONS in the spring every year, you can use that tuition reimbursement to pay for your registration, to pay for your hotel, to pay for your flight and your lift while you're on the ground attending the conference. Also helps pay for your food. So any of those conferences that help better you in your position, that is there for you to utilize if you don't want to use it for tuition reimbursement for a college course. And then you must have your California license no later than July 12th. Not your NCLEX taken, but your California license on the California website on July 12th. So for anyone out of state, I highly recommend take your NCLEX in your home state. It is so much quicker than trying to get your ATT here in California. Take it and then apply for the temporary license and the permanent license here through the Board of Nursing. The temp license generally takes 2 to 3 days to get, and it's good for up to 6 months. The permanent license, through no rhyme or reason, some people get it within 72 hours, some people it takes 5 weeks. So don't put it to where you're just going to hope that that permanent one comes on time, and then you end up missing that cutoff, and we will have to rescind the offer. We do not make exceptions on it. So when you get your ATT, get your NCLEX date scheduled, and keep in mind, if you schedule it the week of the 12th, you might not get your results back in time. If it is not on the Board of Nursing, we will rescind your offer. Thanks, Letty.
Thanks, Carly. Okay, so that is the end of the information session. So we're gonna transition to the Q&A portion of the webinar. So I'm going to stop my share and I'm going to ask our panelists to join. So we have Omar and we have Laura. So I'm going to ask them to come on and share where the area they work and maybe some things that help them be successful. And then we'll start off with the Q&A session from the group. And also before you start, Carrie and Christy will be in the chat as well.
I guess I'll start. Oh, go on.
No,
Go ahead. Okay. Hello everyone. My name is Omar Flores. I'm a new graduate nurse at Stanford. I work on M6, which is our advanced lung disease unit. And yeah, I just passed my 6 months. I'm here to answer any questions if you guys have any. Some things I want to share that made me successful when applying to Stanford was kind of incorporating a well-balanced, kind of having a well-balanced application, like Letty was saying earlier, sharing personal stories and clinical experiences and kind of tying it into how you incorporate it into your patient care, showing cultural competency and yeah, and more. But I'm here to answer any questions. Nice to meet everyone.
Hi, I'm Laura. I am clinical trials. I'm currently assigned to L5, which is the stroke neuroepilepsy. It's an AAU unit. I have my associate's degree, so if any of you out there, you can still qualify for this. I think what made me most successful in this is you'll hear Letty, and she's kind of saying over and over again these same things of show your personality. I think that a lot of people think this is Stanford. I have to be as smart as I can possibly present myself. Y'all are already smart enough to apply for this. You're taking your NCLEX, you're getting your license, you already have what you need. Just show your personality. Don't be scared that you have to be like a scientist at the top tier in order to qualify. So show your personality as much as you can. Also here to answer any questions, so just let us know.
Thank you, everybody. Okay, so I'm going to ask you, put your hand up, and then I'll call on people to ask, and then Omar and Laura, feel free to answer. I think the questions we want here are geared toward Omar and Laura, and I think in the chat, if there's anything specific, we also have Carly in the chat too. Carrie, Christy, Carly, oh my goodness. And so let's go. Any questions? Got them here. All right, Zoe.
Hi, I actually have a question for Laura. Um, so I did see that clinical trials is kind of a big thing. Obviously, it's a learning hospital, and like there's all the education and everything that goes into it and the research. What kind of things do you do as a nurse that works in clinical research?
Absolutely. So for my first, we just hit our 6 month. I've just been kind of like everyone else, just assigned to a unit, learning the trade as it were. And then what I get from my management team, I brought it for you. I'll get like a huge old packet when I get assigned some with the clinical trial, and it has like all the things you have to do and a flow sheet, and here's your care plan. And it really depends on the clinical trial itself. So we do a lot of with epilepsy on my floor. And it can be anywhere. I've had a 4-hour shift where the only thing I did was get my patient a blanket. And I've had ones where we're infusing cells into brain tumors, and I'm just there starting the infusion or a ketamine infusion. So nothing is really like consistent and straightforward of I do this trial and this is what I always know. It's usually like the day before or day of, they're like, oh, Laura, here's this packet and here's what you need to do. And it'll be EKGs, vitals, meds. Or it'll be a double blind study where you're putting tubing through like light filter little sleeves, and you're like, I don't know if this is meds or not, but we're starting it, we're running it. And you're just looking for sensitivity reactions. So it's very, very hit or miss. Just most of the time, I don't even get a clinical trial patient. And then now that I'm 6 months off orientation, I'll be going to float pool, where I'll be going spread across to hopefully get more exposure.
Thank you so
Right.
much. It's super interesting.
And it's good to say, Laura, first they want to develop her and they're starting her off, putting her feet in. So she's just getting started on it. So excited for her. Okay, Kayla, you have a question?
Yes, hi, good morning. I was wondering if did any of you relocate, and if you did, how was the process?
I personally didn't relocate, so I can't really talk on this subject.
I relocated from like 4 hours north. I was in the Reading area. It was rough. It was a little heartbreaking. The rent prices are vastly different than what I was used to. And the relocation assistance helped. Notice that the $5,000 is gross. It was pre-tax, so it came out to like $3,000. But it was challenging. I did all of my onboarding at an outside facility, so I was super scared and paranoid that I was messing it up the whole time. And I was only 4 hours away, so I was still able to drive down here and really look for places. But I had 2 weeks to really find an apartment, and I, taken out a loan for the first month down payment and security deposit, and just coming to terms with the rent prices down here was a little challenging. But after getting down here and getting settled, I gave myself a couple of weeks. This definitely feels like home now. It's really lovely. I will complain till my last day of how expensive it is, but again, just still really happy to be here and happy to have the assistance and support to be able to get down here.
Okay, thank you.
Thanks, Laura. Okay, Shay, you have a question?
Yes, hi, good morning, everyone. I just wanted to ask the current nurse residents a little bit about what they believe the best resources Stanford's provided them with during their time there, and or do they continue to work, do they want to continue working for Stanford once they are done with their nurse residency program?
Yeah, Shay. Yeah, so I think Stanford does a really, really good job at checking in with us. Like when we started out, it's a lot starting out, especially like at Stanford, because a lot of units have high acuities and a lot of things to do. But I think personally, I feel not only the people from the NRP program, but our managers and nurses on the floor also continuously check in on us and make sure we're doing okay. And they also don't just throw you into the mix. They make sure you're comfortable and just frequently check in. And what was the other part of your question?
I asked if you guys were wanting to continue working for Stanford Healthcare after you're done with the nurse residency program.
Oh, personally, yes, 100%. And like Letty was talking about earlier, they have so many opportunities like advancing your education, diving into different specialties, I think, or becoming a mentor. I think I would 100% stay at Stanford. I have nothing but great things to say. And the food is really amazing.
Awesome, thank you so much.
All right, Gabriel, you have a question?
Yes, I had a question about the interviewing process. What did you guys think about the interviewing process? Like, I've had a couple of friends that have been interviewed and they said it's pretty nerve-wracking. So do you have any suggestions on how to overcome the nerves and any like hints or tips for that? And then also, like if you have a list, maybe like your top 2 or 3 favorite things about the program so far?
As far as interviews, I worked in education before this, and I was actually someone who was like on hiring committees a lot. So I'm a little weird, but it was nerve-wracking. I mean, it's a big program, and like I said, I had an associate's degree. I really didn't think I was qualified, so I was just kind of like, ooh, let's see what happens with it. And I think the biggest part, like I was saying earlier, and kind of what Letty's been saying, is everyone was so scared. Everyone on my panels, like not the panelists, but like the people who were interviewing, and they were trying so hard to sound like they were these geniuses. And I feel like I was the only one that was like being silly and throwing my hands up and like making fun of myself for like my first NG insertion experience. And I feel like that really made the difference. And it not only made me more comfortable, because I'm like, I'm just here telling stories. It kind of made everyone else comfortable. You'll see like the questions, it's not like identify this rhythm and what are you going to do about it. It's tell me about a time you learned something, or they're really wanting to know if you're going to fit into the culture and if you're ready to learn. And in terms of what I like the most, exactly what Omar was saying, I don't think I've ever been in a more supportive environment. The people who are here, from my clinical trials unit to this team, to the team on the department that I'm on, everyone is always checking in, always seeing what you need. I have 2 mentors, because why not? And everyone is throwing so many opportunities for promotions, of getting certifications, of continuing education. It's the most supportive place I've ever worked at.
Thank you, Laura.
Thanks,
I
Laura.
personally, sorry to interrupt. I personally, I wrote down a couple of things that kind of helped me with the interview process. I was really nervous going into it, especially because it's a panel interview, so you'll be with other applicants. Personally, I would make our cohort, it was through Zoom, so I would make the the screen really small just to mute everyone out and just, just breathe and, just answer the questions. A couple of like a strategy I used to answer the questions was the STAR method. I think that's really helpful. So the STAR method, S is like the situation, describe the situation, whatever you're talking about. T is the task, describe the goal and what you were aiming to accomplish in the situation. And then A is action, how did you accomplish the task? And then R is result, what did you learn? How did you incorporate that into your practice? But I agree with Laura. Yeah, just no, don't be. It's a nerve-wracking process, but just be yourself. Take a deep breath. They're not looking for like the most perfect answer. They just want to see how you would respond in certain scenarios and who you are as a person.
Cool. Thanks, guys. Okay, Daniel. Daniel, do you have a question? Okay.
Related to ranking.
Daniel,
So
your connection's a little bit choppy.
So my question was
Okay, Daniel, I can't hear you. Carrie or Christy, can you hear Daniel? I can't hear him. No. Okay. We're gonna maybe try to fix your connection, Daniel. Keep your hand up and we'll call on you after. Layla, do you have a question?
Yes, hi. I was wondering so you guys talked about interviewing. What in terms of like, I know we kind of talked about it during the presentation, but in terms of like resume and cover letter, what do you feel like made you stand out in terms of like unique experiences or what experiences you highlighted or like special skills, certifications, things like that?
Well, personally, me, I'm Mexican. I thought that was a big part of my identity. So incorporating your identity, like cultural background. Another thing, that's a good question. And uh, like what Letty was saying earlier, I don't think it doesn't have like when you're talking about scenarios, I personally don't think it has to be like a huge thing you did because you're in nursing school, you're learning. Um, little things do matter. Like for example, I talked about I had a my preceptor during nursing school. It was a clinical, and I had a difficult patient, and the nurse and everyone on the unit was kind of like, oh, like she's really like annoying, she's rude, blah, blah, blah. But I talked about how I just kind of went into the room with an open mind, not having any like preconceived, like judgment, and I had a great day with her. So like things like that, it's not like huge, but it kind of shows off who you are as a person, how you can, interact with patients and coworkers.
Yeah, I think go ahead, Laura. Go ahead.
I was gonna say I put all my job experience. This is a second career for me. I worked in education first, and while I was going for that degree, I was doing retail. And Letty touched on it perfectly. Like customer service is like 80% of nursing. So making sure the experience that you have, if you babysat, like any job experience can be integrated to nursing. So put that experience in, and specifically when you're describing that experience, include how you use those skills for nursing. I also always have little sections like these are my interests, and I like talked about my goats and things on there. So again, personality. So that's what I did. I don't know if it was helpful.
I think Omar, just coming from somebody who read Omar and Laura's applications, I follow you from when you apply. Isn't that great? They had really strong responses, a lot of reflection, a lot of applying what they learned and really outlining it and demonstrating it and showing so much thought. Like Omar said, his example was, interacting with a patient, but his was very thoughtful. So they both really took time to answer the application question. So I'll chime that one in for you too. Okay, Megan, do you have a question?
Can you hear me okay?
You can speak a little bit louder.
Oh, yes. Okay. I hope I'm being heard all right. I appreciate, Laura, you mentioning that you came from an ADN program. I am as well. And my question for you would be, did you have an internship or externship experience applying? That was something that I was a little bit concerned about because it wasn't offered through some of like where I live and through our program. Thank you.
I did not. While I was in nursing school, I was a tech in the ER. I think that really helped. But even my first day, everyone in my cohort comes from all these like fancy schools and they have all these degrees, and I'm like, oh no, I better work really, really hard to keep up. But I really feel like my ADN program, we had so much clinical time, which sounded more like from what I've heard from some of my coworkers. And I was not behind or anything. I felt like I was right where I needed to be. So I don't be discouraged if you're worried about that. But I just had my school. I had my work experience in the ED for 2 years. And that was pretty it for my medical.
Okay. Any more questions? Right now that there's no hands up, I'm gonna ask Carrie and Christy if there's anything in the chat that you want to bring up. And then you guys can think of some questions. We have Omar and Laura until 11:30. So Carrie and Christy.
Thanks, Letty. So a couple questions that came up were about hours. So the positions that we're offering are considered 0.9, which is 72 hours per week, 72 hours over 2 weeks. So that is 12-hour shifts. And as Carly mentioned, that could be a 12-hour day shift, a 12-hour night shift, or you could be offered a rotating shift, which would be a combination or both day-night rotation, depending on the unit that is offering you the position. But it's 0.9, which is considered 72 hours over a 2-week period. A lot of questions, if we could clarify the acuity adaptable unit structure again. So we are hiring into inpatient medicine units, and we call those medicine acuity adaptable units, or AAUs, meaning that they admit patients who have a med surg or acute care, is what we call it, level of care, as well as an intermediate level of care. So you will flex on that unit. Previously, if your patient was on what we called a med surg unit and they needed a higher level of care because maybe they were becoming more sick, you would transfer them to a different unit. We stopped that process so we could have more patient-centered care and decrease the amount of handoffs, right? So instead, if your patient becomes more acutely ill on your unit but does not need ICU level of care, you will continue to manage that patient, but they will decrease the number of patients that you are caring for within your workload, so you can manage that patient. Same goes for the surgical units. The surgical units does not include the OR space. That was a question that we got. So when we say surgical, it's inpatient surgical units: orthopedic surgery, trauma surgery, cardiovascular surgery, ears, nose, and throat, plastic surgery, vascular surgery, transplant surgery, etc. Not pre-op, OR, PACU, or any of the procedural areas. That is not included in that space. There were questions about RN licensure. Yes, you need to have your active California RN license on the BRN website by the July cutoff date. So that is what HR will be looking for. They no longer give you a card or a certificate. So what Human Resources will be looking for is that you are on the BRN website as holding an active California license. Christy, did anything else come up that I missed?
There were some questions regarding repeated questions around the resume aspect of your points in terms of work experience and volunteer experience. And if you have multiple years of work experience, do you get more than 1.2 points? It's like a scale. The answer is no. If you have work experience, then you get points for work experience. Even if you have 10 versus 2, it's the same. Volunteer experience is different. And so there's also some questions on that as well. So that is actually on a scale. And that's why we want you to put the hours in. There's also been questions related to, what if this was 10 years ago? What if this was 5 years ago? So there is no time frame to that, but we are looking for recent volunteer experience.
Thank
And
you.
then one more comment, we do not have a pediatric nurse residency program at Stanford Healthcare. Our sister hospital, which is Lucille Packard or Stanford Children's Health, has a nurse residency program. They have a very robust website that will give you all the information. So they hire into the pediatric specialty as well as into labor and delivery, which is maternal health. So if that's something that you're interested in, I encourage you to look at their website.
Perfect. Thank you. Okay, Maria, she has her hand up. You have a question?
Hi, yes, thank you very much. My question is related to the rotating shift. I would like to know more in depth how does this work? It is, let's say, 1 week in the day, the other week in the night, or how does it work?
There's usually a rotation that the managers, they'll give you a timeline. They'll put you a certain amount of weeks on days, and then they'll put you on nights. So it's depending on the need of the unit, but they will give you a heads up. It's not 1 week to 1 week, it's schedule periods at the very least, which is 4 weeks time. So I don't want to put too much of like, this is exactly how we do it. It depends on the needs of the unit. That's why sometimes they create rotating, because they don't necessarily have a lot of space open on only days or only nights. It varies. So that you will be on days or nights for a period of a schedule at the very least. And you'll
Okay.
have at least a month ahead of time to know you're switching over to the other shift. All right, Corey, do you have a question?
Yes, thank you. It was in regards to housing. How did you go about, to the students who are currently in the program, how did you go about finding a roommate or finding housing in the area?
So Omar and Laura are registered nurses in the program, but I just wanted to give them that. But yeah, how did you guys find housing?
I went online. I live with my spouse. He's luckily also a nurse, so we can afford it. He's my roommate. I just went online and looked at like rental agencies type thing. And then I came down for 1 week and toured like 10 different places. I also have a husky puppy to make things more complicated. So my options were very narrow and I wanted a house. So I just searched online and then came down and saw all the places and like I said, like moved down in like 2 weeks. So
Great. Okay, Lily, do you have a question?
Hi, yeah, in regards to on the resume with clinical experience, so I went to school out of state. So I have my clinical experience listed, but I don't have each hospital listed. Is that something you think I should add on or just leave? I just listed the city where all of my rotations took place. But should I be more specific or no?
I mean, we ask where the hospital is at, but if you want to put the city, that's fine. But if you could fit it in there, that would be good to put it in so we have a reference point. All right, Alicia?
Yes, that's correct. So I'm eventually interested in working in critical care, like the ICU. So I was wondering, what unit would be a good start and what the process would look like to be transferring into there.
Well, that's a loaded question because we are specialty. So it depends on what ICU. We have a lot of different ICUs within the hospital. So we have trauma, we have medical, we have oncology ICU. So it just really depends on where your past experience is, where you want to lead into. So if you're thinking of that track, I would say align it with what ICU you would be wanting to go to and then align it from there in those AAUs.
Thank you so
Okay,
much.
no problem. Lizette.
Hi, this question is for Omar and Laura, and I'm wondering if they can each talk about the most challenging aspect of the new grad program and what have they done to navigate the challenge or that specific challenge.
Hi, Lizette. So I work on M6, which is an advanced lung disease unit. And I think it's like pretty well, my unit's just really heavy personally. So starting out on M6, it was definitely hard. You know, you have your days, you just come home really tired, you're exhausted. But But personally, I think the check-ins that the cohort, that NRP program and our managers have been doing consistently has helped me. But yeah, there was like one day like yeah, just like having a lot of like pre-shift anxiety. But the important thing to remember, like it gets better. You're gonna start out in like this new environment where, some people, well, personally, I didn't have like much um healthcare experience. I just came straight from nursing school, so it was definitely a lot to start out as a new grad on this unit. But I think the most important thing that I've realized is like a lot of my coworkers were in the same position. So you reach out to them, you had a bad day, your coworkers are there, they know what it's like, they've been there. Talking to your mentors, in the program we have mentors assigned to us, so checking in with them and asking for advice, what they did, what they would do, and just like you having open communication with your managers. There's one day I was just like super overwhelmed, and it's just like one of those days like nothing's going right, or like just like a lot of things are thrown at you. And I talked to my manager, and we kind of we had a discussion about what we could do to, ease my anxiety. Or like, for example, the next shift, I told the charge nurse, hey, my assignment is a lot to handle, and they kind of tailor it and they're really open to that, changing your assignment based on how you feel. And just having an open communication has helped me a lot.
Thanks, Omar. Okay, Zinda. Did I say this right? Zinda? Oh, the hand went down. Okay, Kareem.
Hi, can you guys hear me?
Yep.
I have a question for Laura and Omar in regards to the volunteer experience, since it is a point system. Would you be able to speak on how much volunteer experience you guys had and what kind of experience?
So I tried to do pre-med before I did nursing. So I had a lot to prepare for that. And I cast a wide net. I did education, I did unhoused shelters, I did pet like shelters, anything I could get my hands on. I personally had a couple thousand, but it like was spanned over like 10 years. So it wasn't like, and it was part of my pre-med journey. My more recent stuff, I probably had like 100 because nursing school is rough, but mine was mostly old.
Okay. Zarina, I'm just going to move because we have about 6 minutes left, so I want to try to address everybody whose hands up. Zarina?
Hi, sorry, quick question. I know this was mentioned already. I know they're not required yet and don't have to be added to the application, but if you have your RN license or other certifications already, should you keep them on your resume so they're not getting added to the application?
That's your personal preference. If you want to include that and it doesn't take away from anything that is required, that's up to you. Okay, Radhika. Did I say it right? I'm sorry.
Close, Radhika. I'll give you credit though for that. For Omar and Laura, what's the most exciting part about Stanford's new grad RN residency program? I would love to hear your thoughts about that.
Honestly, it's really cool to be part of such like a big important hospital, and to feel like you have the skill set and the support in your team to be able to handle, like, your patients are very sick, and my unit is also very heavy, so there's like times where there's some disease I've never even heard of in nursing school, and I'm like, I'm taking care of this thing I can't even say properly, and it feels really cool to know that you have the tools and the capability and the support that the program really set you up for. They set you up for like self-care to help manage things and how to escalate things, how to speak to physicians, how to really manage disease processes and prioritize. So it's really getting the actual tools to use on the job was really cool for me.
Great.
Yeah.
Go ahead. Go ahead.
Personally, I like the check-ins again. And also I really like the work culture on my unit. We have like a culture, if like a call light is if a patient presses a call light, even though it's not your patient, nurses will go help you. I love like you can relate with to your coworkers, and everyone's just like really understanding and supportive. And it's not like there's no competitiveness, or if you don't know something, they don't make you feel bad about it. They like help you and teach you.
Great. Okay, Zinda, we'll try again.
I'm so sorry about that. I just had a quick question about the the references. So I'm currently an LVN now here in California. So I was able to test out of 2 or 3 clinical courses from the BSN program I attended. So 2 clinical rotations and 1 preceptorship. And I know somebody said that we're not allowed to use our preceptor for our reference. One of the clinical instructors I had quit, so now that leaves me with just 1. What other options do I have?
Zinda, I'll invite you to email newgradrn@stanfordhealthcare.org, and we can talk a little bit that since that's more specific. We can help you navigate through that.
Oh,
Okay.
okay. All right.
So
Thank you.
newgradrn@stanfordhealthcare.org. Okay, Bermel.
My question was for Omar and Laura. I understand that you guys or the program allows us to apply to 3 positions. So what other positions did you guys apply to, and how did you guys go through that process of getting to that floor?
Personally, I did medicine AAU, then surgical AAU, and I think I did emergency. But talking to Letty and everyone, just because I didn't have a lot of experience with critical care, I think it was better for me to go into medicine AAU, get some clinical experience, and then at Stanford you can switch specialties. And that's what I like about that personally.
My first was ICU. My second was ED because my preceptorship was in ICU and I worked ED. And my third, I was like, oh, what's this clinical trials thing? And I just kind of randomly put it on there. And that's the only one I got interviewed for. But my clinical management team, they know I'm interested in ICU. There's programs to transition to critical care. And even I think within like my first month, my manager was like, you wouldn't be able to stay in clinical trials, but if that's what you want, let's get you there. And they've already been supportive along the whole way of getting you in the department that you want. So even if you start somewhere, it doesn't mean you're locked in forever. They're super supportive.
Thanks, Laura. Okay, so we are almost at time. Before I go to Amar's question, I'm going to put a link in the chat, and this is for a survey we'd like everybody to take. Just a few questions. So as you're listening to this last question, please fill it out. It gives us some information on the webinar and things that we can adjust or things that's still needed. So I'll take the last question, and I hope I'm saying it right. Amar?
Yes.
Amir?
Hi.
Okay.
Yeah, thank you. I just have a question. I saw in the chat that someone said we need to list our work, our volunteer experience on our resume. Do you need like just the total hours, or like do you need explanation of what we did? Because I did volunteer at a blood bank, and I did also volunteer at the COVID and flu vaccination clinics during COVID time with the school. So do you need like a description of what we did, or just how many hours we did in
So
total?
we talked about it and it'll be outlined there. So you need the name of the agency or your role and your title, what you did, the name of the agency, like where you did it, the supervisor, and then you're gonna put in how many hours you did, and then you're gonna give a brief summary of what you did, right? So I could say I was a screener at the American Red Cross. My supervisor was Carrie Zoss. I had 25 hours. I did it from May to June. And then I gave a brief description. I think I left that part out, the time date. So put an outline of when you were doing that.
And if I don't have the supervisor like number or like name, would that be okay? Because like we did.
I would say you could email us again that number, but if it's you wouldn't be more specific. American Red Cross is a huge national place. I'm just giving that as an example. So if you narrow it down to maybe the branch that you worked at, but definitely email newgradrn@stanfordhealthcare.org, and we can help you navigate through that.
Thank you. And last
Okay.
thing, when will we receive the recording of this?
We try to get this within 24 hours.
Thank you.
No problem. Okay, everybody. So again, please do submit that form there in the chat. We thank everybody for attending, and we hope to see your application soon. Again, we will put this up within 24 hours. So everybody, best of luck to you. Thanks for attending.
Thank you.
Thank you.